Hello, everyone, and welcome back to our channel where we explore important health topics to help you live a healthier, more informed life. Today, we're discussing a serious condition known as acute kidney injury, or AKI. You might also hear it called acute renal failure. So, what exactly is it? AKI is when your kidneys suddenly stop working properly. This can happen over just a few hours or a few days. Your kidneys have a vital job. They filter waste products from your blood. When they stop working, these waste products can build up to dangerous levels, and the chemical makeup of your blood can get out of balance. It's a serious condition that requires immediate medical attention, and it's most common in people who are already hospitalized, particularly those in intensive care. So, how would you know if you or a loved one might be experiencing AKI? The symptoms can be subtle at first and might be mistaken for other issues. You might notice that you're urinating much less than usual. You could also see swelling in your legs, ankles, or feet due to fluid retention. Other signs include feeling unusually tired or fatigued, shortness of breath, confusion, nausea, and in severe cases, even seizures or a coma. Sometimes, though, AKI causes no noticeable symptoms at all and is only detected through lab tests done for another reason. Because the signs can be so varied, it's crucial to be aware of them, especially if you have other underlying health conditions. This brings us to a very important point. When should you see a doctor? The answer is simple: immediately. If you experience any of the signs or symptoms of acute kidney injury, you need to seek medical attention right away. Don't wait to see if it gets better on its own. AKI is a medical emergency. Getting a prompt diagnosis and starting treatment as soon as possible is key to preventing permanent kidney damage and other serious complications. So if you notice a sudden decrease in urination, unexplained swelling, or any of the other symptoms we just discussed, please make that call or head to the nearest emergency room. It's always better to be safe and get checked out. Now, let's talk about what can cause the kidneys to suddenly fail. The causes of AKI are generally grouped into three main categories. The first is a problem with blood flow to the kidneys. If something slows down or blocks blood from getting to your kidneys, they can't do their job. This can be caused by things like severe blood loss, dehydration, heart disease, serious infections like sepsis, or a severe allergic reaction. The second category is direct damage to the kidneys themselves. This can happen from certain medications, toxins, autoimmune diseases, or clots in the blood vessels within the kidneys. The third category is a blockage in the urinary tract, which prevents urine from leaving the body. This backup of urine puts pressure on the kidneys and can cause damage. Common culprits for this include an enlarged prostate, kidney stones, or certain types of cancer that block the ureters. When the kidneys aren't working, it can lead to a cascade of problems throughout the body. These are the complications of AKI. One of the most common is fluid buildup. This can cause swelling in your arms and legs, but more dangerously, it can lead to fluid in your lungs, causing shortness of breath. Another serious complication is a rise in acid levels in your blood, a condition called metabolic acidosis, which can cause nausea, weakness, and confusion. Your blood's potassium levels can also soar, which is dangerous because high potassium can disrupt your heart's rhythm and even lead to cardiac arrest. The damage to your kidneys can sometimes become permanent, leading to end-stage renal disease, which requires either dialysis or a kidney transplant to survive. AKI also weakens your body's defenses, making you more vulnerable to infections. So, who is most at risk for developing acute kidney injury? Certain factors can make you more susceptible. Being hospitalized, especially for a serious condition that requires intensive care, is the single biggest risk factor. Advanced age is another one. If you already have existing kidney disease, your kidneys are more vulnerable to further injury. Other chronic conditions also increase your risk, such as diabetes, high blood pressure, heart failure, and liver disease. A history of blockages in the blood vessels in your arms or legs, known as peripheral artery disease, is also a significant risk factor. It's important to manage these conditions well with your doctor to help protect your kidneys. How do doctors figure out if you have AKI? The diagnostic process usually starts with a thorough review of your medical history and a physical exam. Then your doctor will order several tests. Urine tests are crucial. They can measure your urine output and check for abnormalities. Blood tests are also key. They measure levels of waste products like creatinine and urea in your blood. A rapid rise in these levels is a hallmark of AKI. In some cases, your doctor might order imaging tests like an ultrasound. This helps them see the size and shape of your kidneys and look for any blockages or other abnormalities. And in rare situations where the cause isn't clear, a kidney biopsy might be performed. This involves taking a tiny sample of kidney tissue to be examined under a microscope. Once AKI is diagnosed, treatment needs to begin right away. The main goal is to treat the underlying cause of the kidney failure. For example, if it's due to a lack of blood flow, doctors will work to restore it, perhaps with IV fluids. If a medication is the culprit, it will be stopped. If there's a blockage, a procedure may be needed to remove it. While treating the cause, doctors also work to prevent complications. This might involve medications to control blood potassium and restore calcium levels. A key part of treatment is managing the fluid in your body. You might be put on a fluid restriction and given diuretics to help your body get rid of excess fluid. In severe cases, when the kidneys are unable to filter the blood at all, you may need temporary dialysis. Dialysis uses a machine to do the work of your kidneys, removing waste, salt, and extra water from your blood until your kidneys have had a chance to heal and recover. Now, you might be wondering about alternative medicine. When it comes to treating AKI itself, there are no proven alternative therapies that can reverse it. This is a medical emergency that requires conventional medical treatment. However, once you are recovering, some complementary approaches might help you feel better and cope with the stress of being ill. Things like mindfulness, meditation, or gentle yoga can be beneficial for your overall well-being, but it is absolutely essential that you discuss any supplements, herbal remedies, or alternative therapies with your doctor before trying them. Many herbs and supplements can actually be harmful to the kidneys, especially when they are already injured. So please, always put safety first and talk to your healthcare team. Finally, let's cover lifestyle and home remedies, which are especially important during your recovery from AKI. Your doctor or a dietitian will likely recommend a special diet to help support your healing kidneys. This diet is designed to limit the amount of work your kidneys have to do. It often involves restricting potassium, sodium, and phosphorus. You'll want to choose lower potassium foods and avoid salt and high-sodium processed foods. Your protein intake might also need to be adjusted. It's crucial to follow the dietary advice you're given. As you recover, your diet may become less restrictive. Staying active is also important for your overall health, but be sure to talk with your doctor about what level of activity is safe for you as you regain your strength. Taking all your medications as prescribed and keeping up with all your follow-up appointments is non-negotiable for a good recovery. Thank you so much for joining me today to learn about this critical health topic. Understanding acute kidney injury is the first step in recognizing it and seeking the life-saving care that's needed. If you found this video helpful, please give it a thumbs up. And don't forget to subscribe and hit that notification bell so you won't miss any of our future health content. Stay safe, stay informed, and we'll see you in the next video.